Mitral stenosis is narrowing of the mitral valve opening leading to obstruction. Mitral stenosis is a condition where the mitral valve, which is present between the left atrium and left the ventricle, it become narrow, restricting the flow of blood from the left atrium to the left ventricle. This lead to increased left atrial pressure and pulmonary congestion. Etiology: rheumatic fever, the most common cause of mitral stenosis leading to valve scarring, and fibrosis. Congenital defect is rare. Calcification of the valve in elderly individual or post radiation therapy can also contribute. So calcification of the valve, congenital defects, rheumatic fever, scarring and fibrosis. Pathophysiology: obstruction of left atria to left ventricle, increase the left atrial pressure, left atrial enlargement. It predisposed to atrial fibrillation. Pulmonary vein experience increased pressure, pulmonary congestion. Over time, this result in pulmonary hypertension and right heart failure. Clinical feature: dyspnea, exertional shortness of breath due to impaired feeling of the left ventricle, dyspnea, fatigue due to decreased cardiac output, fatigue, orthopnea and paroxysmal nocturnal dyspnea due to increased pulmonary congestion when lying flat. So orthopnea, paroxysmal nocturnal dyspnea, fatigue, dyspnea, auscultation diastolic murmur heard at the apex, opening is snap due to sudden opening of the stenotic mitral valve. Sign of heart failure may also be seen in advanced case edema, ascites. So dyspnea, orthopnea, paroxysmal nocturnal dyspnea, fatigue, diastolic murmur, rumbling heard at the apex. Diagnosis: echocardiography, chest x-ray, pulmonary congestion, left atrial enlargement, ECG, atrial fibrillation, cardiac catheterization. Management: medical treatment, diuretic, beta blocker, calcium channel blocker, anticoagulant. Surgical treatment: balloon mitral valvuloplasty, mitral valve replacement. Mitral regurgitation. Mitral regurgitation, it is a condition in which the mitral valve fail to close properly during systole. It failed to close properly, allowing the blood to flow backward from the left ventricle into the left atrium. This result in volume overload in both left ventricle and left atrium. So it is a condition in which the mitral valve fail to close properly during systole, allowing the blood to flow backward. Etiology: mitral valve prolapse. The most common condition is mitral in developed country prolapse. Rheumatic heart disease leads to fibrosis and thickening of the mitral valve, infective endocarditis, annular dilatation in ischemic heart diseases, calcification of the mitral valve. Secondary cause left ventricular dilatation, ischemic heart diseases. Pathophysiology. So main causes rheumatic heart disease, infective endocarditis, annular dilatation, calcification, left ventricular dilatation, and ischemic heart disease. Pathophysiology, volume overload, the backflow of the blood into the left during systole increases left atrial pressure causing the atria enlargement and pulmonary congestion. Left ventricular dysfunction, the left ventricle has to pump more blood due to the regurgitation volume over time. This result in ventricular dilatation, impaired systolic function, and increased workload of the heart, eventually leading to heart failure. Clinical features: symptom dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea, fatigue due to decreased cardiac output, palpitation especially if atrial fibrillation develop, chest pain may be present. Signs: auscultation, holocystic murmur, high pitch best heard at the apex. ठीक है, mitral regurgitation में हाई पिच, और यहाँ पे माइट्रल स्टेनोसिस में था डायस्टोलिक मर्मर, ठीक है, और यहाँ पे है हाई पिच holocystic murmur, high pitch best heard at the apex, radiate to axilla. S3 gallop common in mitral regurgitation due to increased left ventricular filling pressure. S3 gallop is seen. Now next diagnosis, ECG. ECG may show atrial fibrillation, chest X-ray may show pulmonary congestion, left atrial enlargement. Echocardiography, the gold standard for diagnosing MR. Doppler echocardiography can assess the degree of regurgitation. Management, medical treatment, diuretic to reduce pulmonary congestion and relieve the symptom of heart failure. ACE inhibitor can help afterload and improve left ventricular failure. And surgical treatment, mitral valve replacement, mitral valve repair, percutaneous interventions. Aortic stenosis, it is a condition in which the aortic valve become narrow, impeding the outflow of the blood from the left ventricle to the aorta during systole. This result in increased left ventricular pressure, left ventricular hypertrophy, and heart failure. Etiology, degenerative, age related. The most common cause is calcification of the valve, occur typically in older patient. Rheumatic heart disease, congenital bicuspid aortic valve present from birth, where the aortic valve has 2 leaflet instead of 3, leading to valve degeneration and stenosis. Other rare cause include radiation damage, infective endocarditis, and systemic disease like hypertension. Pathophysiology, obstruction to outflow the narrow aortic causes increased left ventricular pressure and left ventricular for compensation hypertrophy, as the left ventricle work hard to pump blood, which initially but can eventually lead to diastolic dysfunction. And the stenosis increase the afterload, which eventually lead to left side heart failure. And clinical feature triad is angina due to increased myocardial oxygen demand, angina syncope due to reduced cardiac output, and dyspnea. Angina syncope and ASD, angina syncope and dyspnea. Other sign: auscultation, systolic ejection, murmur, harsh crescendo, decrescendo, best heard at the right upper sternal border radiating to the neck. S4 gallop due to left ventricular hypertrophy. Signs of heart failure: pulmonary edema, orthopnea, edema. Pulsus parvus et tardus, a weak delay carotid pulse, characteristic of severe aortic stenosis. Pulsus parvus et tardus, weak delay carotid pulse, characteristic of severe aortic stenosis. Echocardiography, aortic valve area less than 1 centimeter is severe. Chest X-ray, left ventricular enlargement. ECG, cardiac catheterization, diuretic, beta blocker. Aortic regurgitation is a condition where the aortic valve fails to close properly during diastole, causing blood to flow backward from aorta into the left ventricle, result in volume overload in the left ventricle, left ventricular function, left ventricular failure, primary cause rheumatic heart disease, congenital defect, infective endocarditis, aortic valve calcification. Secondary causes aortic root dilatation, Marfan syndrome, Ehlers-Danlos syndrome, syphilis, ankylosing spondylitis, hypertension, aortic dissection, pathophysiology, volume overload, left ventricular dilatation, left ventricular heart failure, and hypertrophy. Clinical feature A S नहीं है इसमें angina in severe case, dyspnea on exertion or at rest, especially as left ventricular failure develop, fatigue due to decreased cardiac output, orthopnea, paroxysmal nocturnal dyspnea due to pulmonary congestion, angina, palpitations, signs, auscultation, diastolic murmur, high pitch, decrescendo best heard at left sternal border in third, systolic ejection murmur, Austin Flint murmur, low pitch diastolic murmur at apex, caused by regurgitation of the flow hitting the interior mitral valve leaflet, wide pulse pressure due to increased stroke volume and decreased diastolic pressure, water hammer pulse, Corrigan pulse, wide pulse pressure, bounding pulse, Quincke sign, capillary pulsation in the nail bed visible as a flushing and blanching of the nail bed, Demusset sign, head bobbing with each heartbeat. Diagnosis: echocardiography, measurement, chest X-ray, cardiomegaly, ECG, left ventricular hypertrophy, cardiac catheterization, vasodilators, diuretic, beta blocker, anticoagulant.